My name is Carolyn Bonacci. I'm the Community and Civic Engagement Coordinator here at the University of Scranton. And on behalf of the Office of Community-Based Learning, the Office of Community and Government Relations, the Center for Ethics and Excellence in Public Service, and the Ella Curia Initiative, I'm very happy to welcome you to our last community-based learning talk of the spring semester on the living wage study, the 2022 report that was just released this past November. So the community-based learning talk series has something we've been doing for a couple years now. We started it during the pandemic as a way to give University of Scranton students some insights into the Scranton community, what it's like to live in Scranton, what are the challenges and opportunities that are facing our area, how you can connect and become a part of positive change. I'm from Scranton. I love Scranton. I'm clearly about to have a child I'm going to raise in Scranton. And while you're here at the university, we definitely see you too as members of the Scranton community. And so we're hopeful that this series and talks like this will give you a chance to learn more about the region and how you can become a part of our community and engage with many of the important topics and issues that the community is facing and many of the positive things going on here. So in terms of the living wage report, this report began in 2016, and the university partnered with the Institute, which is a public policy and data research center, to better understand what constitutes a living wage in northeastern Pennsylvania. The initial 2016 living wage report found that the federal minimum wage of $7.25 an hour proved inadequate to enable families in the region to reach a living wage threshold where they could meet their essential basic needs and live a modest but dignified life. And so I'm excited for you to hear today about how this study has evolved and what the most recent report has shown. We're again going to talk about what constitutes a living wage, but also consider related socioeconomic issues, their importance, and what policy recommendations and actions we can take towards a more equitable community here in northeastern Pennsylvania. After you hear from today's speakers, and maybe even during, we're looking forward to hearing some of your questions and feedback, any curiosities you have about it, even if you want to consider ways this is relevant to your own major, your vocation, or what actions you might be able to take to help work towards a more just community in Scranton and the surrounding areas. So today we're pleased to have two speakers. Julie Schumacher-Cohen is the Assistant Vice President for Community Engagement and Government Affairs here at the University of Scranton. In her role, Julie helps strengthen the relationships between the university and community, serving as a liaison with neighborhood groups, community organizations, local, state, and federal government bodies, which is especially relevant considering the living wage report and how that can interface with our local and state level elected officials. Julie's worked for a variety of nonprofit organizations and serves on several community boards. She also has a bachelor's degree in political studies and English literature from Gordon College. She has a master's of public administration from Villanova, and she's currently pursuing a PhD in political science at Temple University. Julie is a major driving force behind the report and can give lots of insights onto why this work is so important. She's joined by Megan Loftus, the president and CEO of the Friends of the Poor Scranton, which is a nonprofit agency sponsored by the Congregation Sister Servants of the Immaculate Heart of Mary. The Friends of the Poor seeks to ease the burden of living in poverty, enhance the quality of life for all who live in low to moderate income homes and communities here in Scranton and the surrounding region. Megan has earned her bachelor's degree here at the University of Scranton, so we're always thrilled to have her back. She then joined Marywood University as a researcher and data analyst while completing her master's of public administration. She's currently pursuing her doctorate of public administration at Westchester University. Megan serves as the chair of the Lackawanna County Housing Coalition and on the executive committee for the Lackawanna County Food Policy Council, and sits on several other committees that address the emerging needs of our community. So I'm very excited to welcome you here today and look forward to hearing what your thoughts are once you hear from our speakers. Thanks.
Thanks, Carolyn. And so Megan and I are going to kind of tag team because she's going to bring in some of the insights that she has from working firsthand in her work at Friends of the Poor. And I'm going to talk a little bit about some of we're going to do both the key findings and then also the recommendations. So just keeping in mind, so we're not just raising up sort of the challenges that we see, but we're also always sort of solution oriented with the living wage study. Let me just say a little bit more about sort of how it came about. So we've done this since 2016. We've had a 2016 report, a 2019 report, and now a 2022, so kind of on a 3-year schedule. It started actually at the initiation of Dr. Mike Allison in the political science department. He had seen a model of this at Loyola University, New Orleans, so another Jesuit university down south, and they had wanted to see what constitutes a living wage in their area. And they used what's called MIT's living wage calculator. And so the basic idea of the living wage is simply that it's enough funds, wages for a family, an individual, to live a modest but dignified life. And so there's a lot packed into what that means, and we'll kind of walk through it. But basically it means that you're able to live independently. You're not needing to necessarily get assistance from, a charitable organization or government assistance. You're really, you're providing for yourself or for your family. And so what does that take? And it takes a different level of wages depending on where you live, across the United States. So he initiated that, and we worked together on that in 2016, worked with the Institute, and also really rooted it in our mission as a Catholic and Jesuit institution. So we'll also be talking about that as we go through to think about, these are our neighbors. These are the people who live in our communities. All of us sitting in this room, too, may have experienced different levels of economic security in our own lives or know people who have struggled. So ultimately, this is a story about the neighbors that we have and live with here in northeastern Pennsylvania. So that's sort of the story of the living wage report. It has also served as kind of a socioeconomic gauge now, so people do rely on it. We just were meeting with Mayor Cognetti a week and a half ago, and she said she takes the report with her to different conferences around the country. So it really is a helpful guide. And if you want to, I don't think you were required to in coming here, but we do have some copies of it. You can take it. And so if you're interested in these issues more seriously, you definitely can take it. It's not too long, but otherwise it's available online. But it might also be helpful for you when you're writing papers. If you're writing things about public policy issues, if you're political science or public health, you may find helpful data in it that you can use for doing research yourself in your classes as you go forward. Right now?
I would just say, so I know Artie introduced as an alumna of University of Scranton, and I work for a Catholic institution, but when I was in school here, I was a political science major, but I also participated in SJLA, and I'm not sure if anybody else did, but I know that we were all required to take philosophy, at least X amount of credits of it. I think you still are. So a lot of my reaction to this report and a lot of the reaction that I get from the community is, so what? Why do we care? And I think that, coming from the university's perspective, we think that it's just understood, that this is who we are as individuals, this is our faith, and this is our moral obligation as humans to care about our friends and our neighbors and people who are living with these circumstances. But that's not necessarily the case for everybody, and we have to be respectful of everybody else's, cultural beliefs or religious beliefs or, where they come from. So I think that one of the key things that you'll see in the study when Julie starts and when we get to the recommendations is, why do we care? Because when we talk about family sustaining wages or we talk about a livable wage, we're not saying that everybody deserves to make enough to go on vacation. I believe that they should. But what we're talking about here in these numbers are only about making ends meet. It's about having a roof over your head, the utilities on, food, clothing, transportation, childcare, and I think there's a slight reading stipend. So, that's minimal, if anything, and maybe you could put that towards Wi-Fi then or something. But it's living paycheck to paycheck. It's not any extras. It's not toys for your kids. It's not going on any trips. It's not even, like downloading an app on your phone or anything. So this is really just the bare minimum of what it takes to survive today, and that's what we mean by dignified. So just keeping that in mind, that regardless of your, political ideologies, we're not talking about everybody deserves to make the median wage or everybody should be paid justly for the work that they're doing or their qualifications. Those are beliefs that a lot of us hold, but that's not what we're talking about here. What we're talking about is, can you survive and can you get to work via, do you have transportation or a way to get to work? Is somebody watching after your child while they're there? And when you get home at night, can you take a shower and put something in your stomach and sleep with a roof over your head? That's it. So I just want to make that clear before we get into it. So we're taking politics and personal beliefs aside and just talking about the bare minimums here.
So we're going to walk through now a little bit of what we actually found. So every time we do this, we're really interested, again, in what does it take to have a living wage. And it looks different across the country, and it has changed in northeastern Pennsylvania. And Sometimes there's a perception, and it's not entirely untrue, that this is a kind of affordable area to live in. So I grew up in the New Jersey, New York area. I moved to Washington, D.C. before I came here, and those are more expensive parts of the country to live in, to buy a house, to rent, and all of that. But what we have found in Scranton is that housing costs have gone up. All sorts of inflationary pressures are going on all over the country, and we have not been immune to that. And so what we've seen here in terms of some of the increases and what the living wage looks like is often surprising to people, because they would think, oh, you should be able to live in Scranton for sort of, less than that. But going to what Megan is talking about, to be able to be not in debt and not reliant on some other type of assistance, you need to make, a substantive amount of wages. So I won't go through all the numbers. I'll focus maybe on the 2 adults, 2 children. That's a kind of, important average household. So we found that in 2022, to reach that living wage, that modest but dignified life, that household needs to be making at least $71,000. So thinking about the kinds of jobs that is going to need, and the access to, again, what kind of housing, all the other costs that are going into it. So it's a significant income, and then it goes up depending on how many children you have and how people are, at the single adult level. So if you're just a single adult, no children, it is lower. So $31,000 would be what you would need to be at that living wage level. One of the things that comes out in the report, and this has happened for many years, is that if you're a single parent, there's a lot of pressure on you. That is most often a single mom. So if you're a single parent with 3 children, single parent with 2 children, those ones on the top right there, $62,000, $78,000, $103,000. So that's what you need to be able to be sure that you can provide for your kids, and especially childcare costs. That's one of the biggest issues for single parents or any parents. They're making a decision when they look at these numbers and think, should I go to work? Should I be in the workforce? Because maybe it's less expensive for me to actually stay home and have one of the parents, be taking care of kids. But how does that even interact with your own vocation, your own interest in life? Maybe you want to be working. So there's all those decisions. But people have to look at these numbers and make their own decisions based on that.
I think it's important to note, too, that in the middle section, the 1 working adult household, there's no childcare included, because it's assumed that the other adult is providing that childcare. So that's why the numbers are a little bit different. As you can see, if you have a 5-person household and only one adult's working, you need $76,000. Where if you have the same amount, but you have 2 adults working, you need to make so much more, because those children need full-time childcare, before, after school, things like that. So that's why the numbers for the same size same size household go from 71 to 90.
If you have any questions throughout, just raise your hand so we're happy to answer questions. Oh. Very dramatic, these slides. I don't remember doing this. So this gives you a sense of the trends that we've seen, okay? So from 2016 to 2019 to now. So the poverty threshold income has basically stayed stagnant, and that's a problem. We'll talk a little bit about that. So that means like what the U.S. government says is the poverty line has not moved at all. So that's a problem, because the economy and inflation, all these different costs, those things have changed, and there's been a pandemic and all these big things that have happened in the world, and yet that poverty line stays exactly the same. The minimum wage income has also stayed the same, because the Commonwealth of Pennsylvania is one of the few states in the United States. It still has $7.25 as the minimum wage. We'll talk later about our recommendations. We don't talk about a specific dollar amount, but the recommendation of the report is that minimum wage is not sufficient. So then you see the blue, which is the living wage income, and so it took a huge increase from 2019 to 2022. Again, related to the pandemic, related to inflation, related to rising costs for all of these different things that people need in their households, and because of supply chain, a lot of those kinds of factors are there. The thing that was really concerning to us, actually, in this time, is that orange line is the median household income. So that's kind of like the average income in this region, Lackawanna County and Luzerne County, the entirety of northeastern Pennsylvania. So that blue line is just above the median income, meaning that the living wage income, what is this place where you have that modest but dignified life, is actually above the sort of average income of our area. So that just is speaking to the fact that we have high levels of poverty, that our wages are not as high as they should be, and that our costs are basically, have gone up in the area. But that was something that was very concerning to us in terms of looking at these trend lines from the 3 different reports. Okay, so we wanted to dig into housing, and actually Megan and I just came, we were at an all-day meeting at the Radisson about affordable housing in the Scranton area. Again, a perception sometimes that Scranton is affordable. It is more affordable, as I said, than New York and Washington, D.C. People also make more money in those metropolitan areas. The wages are higher. Some of the sort of baseline data that came out of the living wage study had some older statistics from, it wasn't quite coming up to 2022, so we wanted to break it down. And so we looked at Zillow. You might have used that app on your phone, but that looks especially at rental prices and rental sort of fluctuations. And so you can see all the way back from March of 2015 to July of 2022. And so we've just had this increase of rents, especially increasing though from July of 2020 to July of 2022, which is the pandemic time. And so we have seen, and it's even more dramatic than even this graph is showing, pretty radical increases for Scranton in terms of rental prices. So people are paying at least over $1,000 for, 2, maybe 3-bedroom apartments. It's going up to as much as $1,400, $1,500 in some of the downtown apartments. And these are just not rental prices that families and individuals are really able to pay. So we're seeing a lot of gaps, and that's a lot of what we talked about all day. What are some of the solutions to be able to create more affordable housing units in the city of Scranton? There has not been pretty much any affordable housing units added for the last, we're talking basically 20 or 30 years. There's a lot of market rate housing that's being added. So if you walk downtown and you look up into some of those buildings, a lot of those buildings have been turned into beautiful loft apartments, and that's good for the city in some ways. But we have not seen a similar increase of apartments that are affordable for families and individuals. So that's what that is indicating. So this is kind of a grab bag of some of our sort of takeaways in terms of the overall findings. So I already mentioned one of those graphs that showed that, especially for households with children, the regional median household income is below that living wage threshold. So just economically and sort of thinking about the region, that's just not, that's a trend line that we want to watch. That's not, we want to see the reverse. We want to see the regional median household income above the living wage threshold. The number of households in poverty is disproportionately high still in northeastern Pennsylvania, and community agencies, and Megan will talk more about it, have been more people seeking services, more people who were first time, who didn't seek services. Maybe you want to talk about that even for a moment now.
Absolutely. So I have been at the agency that I'm at now since 2017. In 2019, we have a lot of different programming, and I won't go into all of it, but one of the main things that we provide is emergency food, so food pantries for individuals in need. And in 2019, we would serve roughly 1,900 households per month. Right now, that average is 6,600. That average is 3,000 and change, which equates to 6,600 individuals per month. So that has, more than tripled in just a few years. And the rate that we're seeing right now, as of, I think the last stats I have were for the month of March. So for March of 2023, we're seeing the same numbers that we were peak pandemic when people were first laid off. So, April, May, June of 2020. At the same time, a lot of the extra benefits that were available for people along with the pandemic, like there was SNAP extra allotment, so people got an additional SNAP payment every month and things that could help them afford some of the inflation costs on their own. So SNAP is a card, a dollar amount that families who are eligible are allocated each month to then go use at the grocery store. So some people call it food stamps or EBT or SNAP, but all basically the same thing, and that it is a debit card that you can use to purchase food at the grocery store. So an extra allotment means that instead of getting it once a month, they were getting twice a month. That second payment was a little bit lower, but still it's a complete second payment, and that has completely disappeared. So for example, a single elderly individual living alone on a fixed income was getting, with SNAP extra allotment, $283 a month, or $281 a month to buy food on. So $281 was like here you go, there's a global pandemic, here's some extra money. That's taken away. Now they're getting $23 a month. So, you can't even afford one pack of ramen a day for that. So thinking about some of the disproportionate rates of poverty are because, like Julie said, the federal poverty level, which is, the rate at which all of these entitlement programs are based, hasn't moved at all, but everything else has increased fairly significantly. And so this benefit cliff, which we'll get to in a second, is kind of everybody that lives above the poverty level but below the living wage and needs some sort of help, but they're not going to get it from the federal, state, or local government. So they have to rely on agencies like mine. And that's basically what we mean by more people coming at this point.
So one thing that we did in this 2022 report, which we hadn't done before, was look at racial disparities. And we were also, acknowledging that was a gap in our previous reports. And so we really did dig into that data with the help of the Institute. And so what we found was that there are some real disparities, especially in terms of lower rates of home ownership. I wanted to pull that out. So when we look at home ownership rates in Lackawanna County for different racial groups, so for white families, about 68% are homeowners, and for Black or African American, that goes way down to 16%. So we have a really big gap in terms of homeowners. There's also a gap for Hispanic families, about 20%. So that's a problem, and that's something that I said as we were just at this all-day event, really talking about what are the causes of that, what are some of the historic causes of that when you think about redlining, when you think about racial discrimination. There is not an official redlining map in Scranton. There is one in Wilkes-Barre, but there's also been research by our partner at the Black Scranton Project looking at redevelopment projects in the city of Scranton that displaced the Black community in the 60s and 70s. So there are historical impacts, and of course, the national realities of the racial wealth gap, and just the legacies of racism in the United States. So that's something we pulled out of the report and are definitely, and also lower median incomes among Black and Hispanic Latinx households as well. And you'll see in some of the recommendations that we also look at what are some of the solutions. Rising costs, we've talked about healthy food, transportation, childcare is really significant. And so again, inflation, the pandemic, other factors. We'll talk more about this, but affordable housing, we've already touched on it. And I'll just give an example from my own life. When I first moved here in Scranton about 13 years ago, I rented an apartment with my family, for a 3-bedroom apartment in the Hill section for $700. Those apartments now are going for anywhere from $1,200 to $1,300 to $1,400 to $1,500. So a big increase. Again, some of that means that people want to live in Scranton. They're moving here, and that's a positive thing. But what that means for long-standing residents whose incomes have not risen in that time, it means that we're having effects where people are being evicted. We have people are facing eviction. They're having to move. They're housing insecure, and so those are problems that we're seeing in the community. You want to talk about that?
And the benefit cliff is just what I had alluded to before, but it is just that the area that the majority of Scrantonians living in poverty live in, I guess they're not even considered living in poverty, but they're the ones that we are talking about that are above that in federal poverty line, but not at a livable wage. So do we have the poverty line in here? I had this marked, sorry about that.
But there's also a lot of misperceptions, so people have an idea that, people may not be, they're receiving government benefits, but they're not working, or just sorts of stereotypes that go along with receiving government benefits. But the reality is that, as Megan is saying, that threshold is very low for the poverty level. All you have to do is go sort of a step over that amount, and you lose these benefits. And so people have to, make hard decisions to decide, okay, if I work a little bit more, but then I'm going to lose that benefit, am I really going to be able to afford my bills? And so a lot of the nonprofits advocate for those thresholds to come up, or they do in their own work. They relax their requirements if they can. If it's a federal government, subsidy, then there's not a lot of flexibility. And so again, you won't qualify for it, but you can't go out on the market and afford things on your own. So it's really a problem.
So the federal poverty line is defined by household size. They don't break the household size out, but household size for a family of 4 in 2022. The federal poverty line was $27,750. So in this living wage report, a family of 4, 1 adult with 3 children in Lackawanna and Luzerne County would need $103,605 to live dignified but small, like I said, not extravagant life. If there were 2 adults and 2 children and one of the adults was working, they would need $71,000. And if both adults were working with 2 children, they would need $90,605. So in all cases, they need a minimum of 2.5 to 3 times what the federal poverty guidelines are. And so everybody who's living in that median income range is not eligible for benefits, but is struggling.
So the last 2 times we did this report, we wanted to hear from people who have experienced economic insecurity themselves, for them to talk about what they see as some of the priorities or some of the things that they're struggling with, and to hear that firsthand, and to have their input also inform the report itself and inform the recommendations. So we worked with various nonprofits, and I should have said from the beginning too, if you do read the whole report, one of the things that you can get is quotes from all sorts of community leaders, including Megan and others, and probably about 15 different community partners who all reflect on the living wage study and talk about it from their own perspective, from the work that they do. So Neighbor Works and United Neighborhood Centers, the Black Scranton Project and their perspective on some of the racial disparities, colleagues that work with our immigrant communities. So there's more data here, there's more than we could share, but they gave us referrals, and so we went out and did some interviews to get kind of the grassroots perspective. And so I want to thank our interviewees. So you're just going to hear, this is just going to be kind of a excerpt video. It's about 3 minutes where they just share some of the highlights of the interviews.
My biggest challenge right now is just with the children at home, I can't find proper daycare because daycare is ranging up to like $500 per child. And with 3 of them, how is one person affording just that?
I know that having more income would be better for me because I started working at $7.25 an hour. So I know that that's what the minimum wage is here. I think most people know how difficult the struggles are. The inflation, food, gas, apartments. I think since COVID, I think everybody knows that it's expensive to live here.
My biggest challenge reaching economic security is, I would say in a nutshell, be employment, because a lot of employment don't pay the rates people should be having when they have a job. For example, I have over 25 years of experience in security, but most security jobs I had pay anywhere from $8 to $10 an hour. The wage is not enough. They want you to do astronomical work. Most jobs I had, they pay one rate, but to have you doing the rate, but you should be paid 2 to 3 times more than what you're getting paid.
A lot of my salary goes to the government, and there's no way for me to get it back. Like, I don't qualify for anything, nothing, because I'm single and I have no children. So sometimes I feel punished because the system is geared towards families and unity and more than one person. But what if you don't have a person? It's not by choice, it just happens. So I think one of my biggest challenges would be taxes. It's like it takes all my money.
In the past couple of years, I got diagnosed with a stage 4 form of cancer, and with paying upwards to about $1,000 for chemotherapy medication, you don't have that money in your pocket for dinner, for extras, for clothes, for even transportation and doing bills and the whole 9 yards. You don't have that money for it. So that has been contributing to why I cannot become secure.
And then I just have a couple slides before we get into the recommendation of some interviewees that we didn't get into the video, but I want to honor what they shared. And this is Mary and her daughter Donna. And so Mary lives in the Hill section, and she was talking about her income challenges being on Social Security. So she's on a fixed Social Security income. And then her husband died, and she lost his Social Security. So this is a real problem for older adults where they are able to sustain themselves with those two Social Security fixed incomes. But then if a spouse, passes away, you lose that. But she still needed to keep her house and have, similar expenses that she might have had in the past. And so she's talking here, once we lost his Social Security, I don't have the money I used to have to go into bills and things like that. She was helped in particular by Neighbor Works, which is an organization that is very focused on older adults and helping them to be able to age in place and to stay in their neighborhoods. This is her daughter, Donna, in the quote. She's talking about how they had bought the house and they have a mortgage, but that when he passed away, the income was not there and it became even tighter. They're not really able to afford the mortgage at this point. Just a little bit more again on how the finances are very difficult. She's talking about the option of, for senior citizens in Scranton to move into a senior high-rise building. That's some of the options you might have for affordable housing, but it's a long waiting list. And she also wanted to stay in her home. She's lived in the Hill section for many years. Again, NeighborWorks was able to come and help in terms of some of the home care and things like that, and helping with the mortgage, but some of that funding is not necessarily permanent. And then her daughter, Donna, again, sort of talking, this is not so much the benefits cliff exactly, but just there's a lot of bureaucracy if you're trying to access different types of government assistance or other types of charitable assistance. There's waiting lists, there's income restrictions, and she had experienced through her mom's experience that there was a lot of barriers, and hoping that some of those barriers could be eased. So that's just the reality, again, of another neighbor here in the Hill section, of somebody who's older, who's lived here for a long time, and who's struggling to stay in her home. And of course, we're giving you a lot of sort of bleakness, but there's a lot of nonprofits and good work being done in the community, and that you have opportunities to be part of through CBL, through community service, to assist that work, through NeighborWorks, through Friends of the Poor, and through various agencies who are there to try to fill in these gaps. We're going to transition and move into the recommendations. Let's get through in about probably 10 minutes so that we leave time for questions.
Does anybody have any questions now before we get into the recommendations that you just don't want to forget? So basically, the recommendations that we're getting into are my so what. So we did all of this research, we've shared it, we've talked about it, but what does it mean? How does it get out of this booklet, and what does it do for the community? So the recommendations are rooted in Catholic social teaching because of the institutions that created the report, but again, it's applicable to everybody regardless of your faith background. So there's 4 main recommendations. They're broken out, I think, into 7 or 8 in the report a little bit, but we're supporting housing assistance and affordability, fostering equity and inclusivity, increasing wages, and expanding access to effective social safety net programs, and ensure that we're addressing rising costs of basic necessities. So basically, I can't stop saying basically. Have you counted how many times I said it? What we're talking about here is advocacy. We're talking about getting involved in the community and helping the agencies that are already completing this work. We're talking about educating the general public, educating not just our lawmakers, but other people in the community who are voters, who are donors, who are volunteers, and letting everybody know all of the work that's gone into this and what the data says and what the reality is for the people that they don't see every day, or the realities that they don't experience. So first and foremost, we're talking about housing. Housing stock in the Scranton area has reached catastrophically low levels. So if you have been trying to find off-campus housing as a junior or senior, it's relatively difficult. A lot of people start early on in their sophomore year trying to find something for junior year. And also noting, when I went to the University of Scranton, I lived in an off-campus apartment my junior year with 6 other girls. So there were 7 of us in a house, and we each paid $500 a month towards the rent, and that didn't include any of our utilities. So that total rent was a lot that the landlord was making. Didn't seem like that much to us because $500 doesn't seem like a lot, but you're also sharing something with 6 other people. So just thinking about the housing that we have set aside for the medical college, for the University of Scranton, for Marywood, that landlords are targeting those apartments towards, are units that are not affordable and not available then for other individuals living in the community. Because even if somebody had 2 well-paying jobs and they had 3 or 4 children, they can't afford $3,500 a month that landlord is making from students. So there's a lot of things that we need to do, starting with zoning changes and hoping to use the zoning changes to increase the development of new apartments and new housing. Talking about mixed income development, so that is also DEI focused, in that a lot of the development we've had so far has just been luxury downtown apartments. And like Julie said, there's studio apartments being built downtown for $1,700 to $2,200 a month, and it's a studio apartment for one person to live in. That's not affordable. for anybody who's making the median income or lower. And it also then silos our area completely into there's pockets of this is where people who are living, in under the federal poverty line are living. This is where people in that benefit cliff are living, and this is where people who are making more are able to live. And so it becomes a really segregated community. Cash assistance to home buyers, talking a lot about first-time home buyers, whether it's your first time of your own home and you have lived in a home somebody's owned before, like your parents have owned it, or you're the first in your family to ever own a home. There are a lot of barriers to purchasing your own home, including how much you have to put down, what your debt-to-income ratio is, and how to even navigate that market. So talking about helping individuals there, and developer incentives to not only develop mixed income apartments, but also lower income, and just kind of considering where you're putting housing as well, that you're not separating low income from higher income and luxury apartments. So again, effectively reinstating segregation. Did I miss anything there? Fostering equity and inclusivity, talking about equitable access to service and benefits, centering the voices and experiences of the BIPOC, economically disadvantaged, and formerly incarcerated. Anybody who is thinking about working in the public sector may have heard about the framework for approaching public administration, and since 1887, the framework has talked about effectiveness, economy, efficiency, and equity was included in the late 80s with the first Middlebrook Conference. So it's the first time that ethics or equity was brought in, and that was 50 years ago. It's still been the last and fourth pillar that's not really been focused on as much as efficiency, effectiveness, and economy. So whenever any of us are talking about our government systems, we're typically talking about, are they effective? Are they spending like the public dollars wisely? Is anything getting accomplished? And it's going to depend on where you land on the political spectrum on what your opinion is on that. But at the same time, that's how we are all collectively, regardless of our own ideologies, are measuring the success or failures of the government. Are they doing what they need to do with the least amount of resources possible? What that does, though, is kind of take us a step backwards. It doesn't allow us to focus on any DEI efforts, and it doesn't allow us to really measure the impact of what the government policies or what the nonprofit programs are doing. So there are 4 new pillars that have been proposed just last year, and they talk about engagement, empathy, ethics, and equity. So you start with engagement, which talks about centering the voices of the individuals that you're serving. So rather than talking about the legislators and the policy and the administrators who are implementing it and what they're doing, talk about the individuals who are the benefits or the stakeholders or are receiving those services, and what's their experience. Is it helping them? Are they waiting 2 full work, like do they have to take 2 full days off of work to go down to a benefits office to be able to get cash assistance, and then they lose their job because they had to take those 2 days off and the bus system's not working for their benefit? There's a poverty simulation that's amazing. It'll show you how to do that, how that works for individuals. But basically, somebody get a buzzer for me when I say that word. In general, it would take one individual in the Scranton area an entire workday to just go to a public assistance office and a doctor's appointment. Those of us that have transportation can take 2 hours off of work and do that and not lose our jobs. But if you have to consistently call out of work and you're an hourly employee without paid time off, and you're taking the bus, you end up losing your job and needing the assistance even more, but then you can't afford the bus, and it's a vicious cycle. So that engagement talks about talk to the people who are experiencing this and learn what their obstacles are. Empathy then talks about internalizing what you heard and what you learned and understanding the plight that individuals go through. So those are the first 2 steps that you need in order to really be a good public servant, to understand the community and understand people's experiences outside of your own. But then most of the time we've stopped there, and we need to continue and make this an active lesson rather than a passive. So that's when we get into equity and ethics, which was the previous slide. So talking about equity and ethics talks about making sure that not only is it a fair system and that everybody is receiving things that they are eligible for or entitled to, but also pushing that one step further and helping people who have been historically oppressed and giving them an additional step forward. So if you've taken an ethics class or you've done any sort of studies of ethics before, you may have seen this cartoon where there are 3 little kids standing at a fence trying to watch a baseball game. And they're talking about, they're all different heights and there's different things in front of the children blocking their view. So they're saying that equality is giving them each a box to stand on so that they can see the game. Equity is removing the fence and the barriers that are in their way so that they can all see based on where they are. So we're talking here about fostering equity and inclusivity and engaging individuals that this impacts most, but also talking about the fact that we have a moral obligation as Catholics, as people, as individuals from a Jesuit institution, and even just as a human being respecting the dignity and autonomy of another person, to help somebody that has been systemically oppressed and use the voice that we have, that is, understand that we have this system of privilege or this state of privilege, whether you realize it or not. You have the ability to amplify your voice and let somebody else's story be heard.
And I'll just add that one of the sort of tenets of Catholic social teaching, I'm really wrap up in a second, that people don't often hear about is a word called subsidiarity. And that's one of the reasons why we also was a motivation for doing those interviews, is that we want to hear from people who are most affected by policies. And so obviously Megan's talking about how that's even coming into government policy. So not making policies or recommendations from up here, but actually making them based on people who are closest to a problem. And that's a part of Catholic social teaching, it's a part of a social justice ethic, is to make sure that the ways that you're solving problems are actually really sensitive to the people who are actually experiencing problems.
And then are we measuring the success of that based on how well we solve the problem versus how effective or efficient we were with our resources? Very obviously, we're increasing wages and helping workers obtain and keep jobs with family-sustaining wages. That doesn't just include increasing in minimum wage and disparities in education, but it talks about transportation and childcare. So the one person that you heard from said childcare was $500 a month. That's with the most subsidy that you are eligible for the most part. When my child started daycare and he was 9 months old, it cost me $1,000 a month to send him to daycare. So I am the CEO of an organization. My husband does well himself. I went to school here, so obviously, sorry, I have a lot of student loan debt. But I also continue to go to school, so I have a lot of student loan debt. I would not have been able to afford a mortgage or childcare at all if I just had my student loan debt and my income. So thinking about how this doesn't just impact low-income workers or menial wage jobs or people who are working at an entry-level position. This is widespread. Even if you're making, like Ronnie talked about, $10 an hour, full-time work is 2,080 hours a year. So you're only making $20,000 if you're making $10 an hour. Again, you're far below the poverty line at that point. So there's a lot about paying people what they're worth, but paying them in scale, I guess, for how many hours they're putting in and things. And then the last recommendation is broken out a lot more in the book, but expanding access to effective social safety net programs and ensuring they focus on addressing the rising costs of basic needs. So that's increasing the federal poverty level, that's increasing the ratios of, maybe graduating the scale. So rather than just saying somebody now makes 200% of the poverty level, they're no longer eligible for anything, maybe we can graduate that scale so that, at this point you get 100% of the assistance availability, and then you go to 75, 50, 25. So what are things like that we can advocate for? Expanding cash assistance, and then availability of other products outside of food. There are a lot of people that come for food, but think about what else you pick up when you go to the grocery store, go to Target. There's toiletries, there's diapers, if you have children, hygiene items, anything like that are not necessarily available always at a food pantry. So thinking about all of those different things and making sure they're available, but also if we're not just putting the burden for that on community-based organizations that aren't receiving federal funding for it. So if we're talking about, this, giving people access or providing this kind of service to an individual is a community-based organization's job, that's one way, that's one approach, but then there has to be funding behind it. Otherwise, the money that we're paying in taxes and the policies that we're implementing aren't funded directives, and then we're kind of just saying, yeah, this is how it should be, but we're not going to support that, and then that's when the programs kind of fall apart and the initiatives fall apart. So unfunded mandates are nobody's friend. And my point in being here and explaining all of this to you is that these are all things that you can do currently. Like Julie said, you can go out and volunteer, you can take part in your CBL programs, but you can also think about what you're going to do next and what you want to be, what you want your career to be, what your vocation is when you're done with school at the University of Scranton. Are you going on for continuing education? What field are you going to look for a job in? The market's pretty competitive right now, but it doesn't necessarily mean that you have to take a job, the first job that's available to you, and that you're not going to get paid well. There's a lot available to you, and there's a lot available if you work in the public sector. There is, first and foremost, public service student loan forgiveness, so 2 years away from that. Let's hope that it still exists then. But also, if you are an accountant, or you're a scientist, or you are a statistician, or whatever you're going to school for here, there's that job in a public sector and in the private sector. So if this is something that interests you, or you feel called to this and you want to be part of some sort of systemic change and continue to set the world on fire, you can do that with your vocation after you leave here. It just depends on what field you go into, what kind, public sector, private sector, and what kind of organization you work for. And the more people that are drawn to those social justice-based organizations, public or private, but people that want to make systemic change, the louder our voices are, and the more our message is amplified, and then the quicker that we can enact change. So that's the main point.
Yeah.
And I think that's it.
Yes, so we have about 10, 15 minutes. We will not go over since it is a very sunny day and it's Friday. But if you have questions or comments or things that you want to offer up. Oh, sure, okay.
Hi. What would be, you actually kind of answered my first question in just regards to what's the best way students can get involved. What would be the best way that you think the university as a whole and the university community could get involved to better foster the recommendations that the report provides?
Well, I think there's a few different ways. So all of us, we all have our different roles as staff, as faculty, as students. As students, you have different opportunities. We've talked a little bit about it through CBL. Some of you are in the PCPS college. Many of you are, and you have CBL as a requirement. So you're going to do that over over your next 3 years after this first year requirement. So really, that opportunity is there for you. And take advantage of it, and also think about, you may be part of a CBL project or service project, and you might want to intern for the organization. So kind of, be able to dive even deeper into the work of the organization. This study has also shown a light for us institutionally about how we can also raise our wages, and so we've done that since it was first released in 2016. Our lowest wages at the university have gone up, and it always sort of puts a little bit of pressure on everyone in the city of Scranton to look at what do our lowest wage workers make and how can we make that better. So I think, that's kind of a pressure point, I think, for all the anchor institutions and any employers in the city, is to just look at how can we do better for our employees. So, but as Megan has talked about, just thinking about all these issues and really what you want to do with your life and how you can make change after you leave and graduate and how that's going to affect your vocational choices. I think this is a good time to kind of, be mulling that through.
And I would say institutionally, Scranton and Lackawanna County is a meds and eds community. Our biggest anchors are educational institutions and healthcare. And so being the biggest cornerstones, you all, because I guess I don't take part of that, have to be vocal. You have to model the change, like Julie said the university is doing, but then you have to talk about it. And I didn't know that the wages were raised. So talking about that, and there's a degree of humility with our faith and with the religious that are behind us, like the Jesuits or the IHMs that are behind me, but there's also a degree of, we're doing this and we're telling you about it, not because we want a pat on the back, but because we want to model it and we want you to know that this is important, because the people that are working and sacrificing so much of themselves for your mission don't deserve to need to access these benefits in order to survive. So there's modeling on one hand, and then on the other hand, I think it's more or less pushing the students out there to say, this is what's available, or this is what's happening in the community. A lot of the students in this, I think, are still from the tri-state area. And so poverty here might not look like what you're used to seeing poverty at home. Public transportation here doesn't look like what you're used to seeing at home. And so understanding what poverty looks like in different areas, but that it all basically has the same detrimental effect and needs to be addressed equitably is very important. And taking that message on with you to wherever you go next, whether you stay in Scranton or you go elsewhere. I mean, I didn't think about poverty on any sort of scale or anything that I could do with my life until I came back from studying abroad in Rwanda when I was in school here. And I saw a lot of poverty in Rwanda. Then I came back here and I had already lived here 21 years of my life, and I started recognizing that there were individuals living on the street and in the like Heritage Valley Trail and places that I had just been blinded to up until that point in my life. So I think it's just, be aware, approach everything with your critical consciousness, and make sure you talk about it ad nauseum, because eventually somebody's going to listen. Anybody else?
Well, if you do have other questions, feel free to come up and talk to us. If you are interested in other ways to get involved with CDL and service as well, we're happy to.